So you may be wondering, I've read so much about AI. I see all these things about AI. How is AI going to change healthcare and my health? Well, in today's video, I'm going to give you 5 predictions of how AI is going to change how we do medicine. And stay tuned to the very end, because I'm going to give you probably the most important way that AI will change the way that we do medicine today. Guys, let's talk about this. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert, but board certified gastroenterologist trained at the Mayo Clinic, can see Celeb Gastro for all your GI needs. Number 1 is that AI will change how we monitor health and help out with preventive care. Medicine right now is very reactive. You have a disease, I react to that and give you some treatment for that. We've done a very poor job about prevention of health. And I always believe that if we can prevent a disease from happening, that is going to be the best thing for you and the best thing for our healthcare system. With the way AI is right now, we're getting to the point in time where we can start preventing problems from occurring. And we use AI all the time to monitor how we're doing with our fitness. You know, we use our Apple Watch, our Fitbit, we measure heart rate, blood pressure, we see what zone we're in when we're working out, and we can start to utilize these techniques to find out exactly what we can do to help prevent illnesses from occurring. AI solutions such as using algorithms, collecting big data, getting pressure points, seeing exactly what's going on is going to be a way that we can actually take a population and find out how they're doing and proactively see what route they're going to go down, and we can measure that progress with the use of AI. We've done it during COVID-19. We use it to track infectious diseases like malaria, and I see this as a way for us to see how we can do disease prevention as opposed to disease reaction. Drug development. Did you know it can take decades for a drug to be developed from point A to the very end? Decades. It involves multiple human trials, layers of tape, and literally millions of dollars to get a drug approved. With AI, we can simulate a lot of this information. There are scenarios that are out there that we can give a potential drug to, try to see how those scenarios play out and make a difference with that. We've seen some evidence of this in other studies, and we're seeing the slow beginnings of using AI to predict how medications are going to do in a real world population. Once we see this on a larger scale, I really foresee the development of drugs to be a lot quicker. We can see side effects more. We can see how these medications are on a larger population, or maybe even specific populations. So we don't know for a lot of our African American patients how the drug's going to do. We can use AI to harness that information to see how it works in that population. We don't have a lot of studies on women as well, so we can use AI to see how these studies are going to work on women. And I really see drug development as a way to get speeded up and shorten the process to hopefully get a drug for you and for me. AI can certainly help out with surgery to see if we can get into the areas that may be difficult for us to get into from the human hand. Not only that, it can help out with assisting in the actual surgery itself. AI machines have been used in multiple surgeries, and the data is fascinating in terms of improvement of mortality, less complications, and better outcomes. But not only that, all the data collected in those surgeries can at least teach us the best approaches to get the type of surgery that you need. So for example, if we have one surgeon who has a certain technique that has been shown to have better outcomes, AI can collect the data from that, get the best practices, and distribute that information to whoever wants to try and do that surgery. I see this as a fascinating adjunct for what we're doing. Now, I certainly don't expect AI or robots to do surgery for us. It'd be kind of weird. I don't think I want that, but I can see it as an adjunct for what's going on, to improve what's going on, and to find out data how to make things better as well. I also see AI as a way to enhance what we're already doing. So for example, my bread and butter is doing procedures. I do colonoscopies, I do EGDs. I do these to find diseases, to prevent diseases, and diagnose cancer as well. We have seen studies after studies suggesting that using AI to help enhance what I'm doing can improve my outcomes as well. When I do a colonoscopy, there may be small little subtle things that I may be missing because of the prep, how the colon is, just human nature. We have seen studies to suggest that using AI can enhance my capabilities to find these precancerous polyps, but not only that, but actually diagnose them at that time for what they have, as opposed to sending it to a pathologist to find out. So enhancing what we're already doing in medicine is one way that AI is changing the way we're doing healthcare even today, and I foresee that in the future as well. Data collection and administrative tasks. Half of my job and my staff's job is to do admin work, whether it's collecting data for insurance companies, doing a pre-authorization, making sure the medication is sent to a pharmacy, doing my actual note. Most of my time is spent doing that and not actually taking care of the patient. I see AI as a way to take these tasks that are mundane, that are routine, that you actually don't need a doctor to do, and do it in a more efficient manner. Imagine that I come see you, I have my AI scribe doing my note, I can do my whole focus for you, we talk about options for you, medication treatment, and then an AI assistant will send the medication to you, to your pharmacy, that has all the side effects, but also can make sure that your insurance will cover it and that it will be not expensive for you. This is one of the ways that AI is going to change the way that we do healthcare, because taking these admin tasks away from me and from other staff members is going to cut back on the amount of work that I have to do that's not patient related and will allow me to focus my care on making sure you're doing better. And actually, I see this as probably the most important change that AI is going to do when it comes to changing healthcare and changing how we take care of our patients. This is a fascinating time for medicine. These are 5 predictions that I see how AI is going to change medicine. Let me know in the comments down below. Do you agree with this? Do you have other suggestions, other changes? What do you think is going to happen? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get great tips and tricks like you're learning in today's video. Thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.